If you've been telling your doctor or PA for months or even years that you're exhausted and you keep getting told your labs are normal, you're probably just stressed, I want you to hear something. You're not crazy, you're not lazy, you're not making it up. Hi, I'm Kevin Davis, family practice physician assistant here at MCHC Clinic. And I see this every week in my clinic. A patient comes in, they're exhausted, their basic labs look fine. Their last provider may have sent them home with a pat on the head and said, try to get more sleep and don't stress as much. That patient almost always has something really going on. So today I'm going to walk you through both sides of the fatigue conversation. The lifestyle side that doesn't show up on a lab at all, and the medical side that needs the right labs to find. Two buckets. In my experience, fatigue almost always comes from one or two places. Most patients have something in both of the buckets. Bucket one is lifestyle. What I mean by that is sleep apnea, lack of movement, chronic stress, anxiety. The boring stuff that nobody wants to hear about because the solution is always to change your life, which is way harder than taking a pill. And bucket two, medical. Thyroid problems, iron deficiency, vitamin D, B12, early insulin resistance, low testosterone, hormonal shifts, the stuff your standard lab panel almost certainly missed because most providers don't run this for the right test. I'm going to walk you through both. Then I'm going to tell you in the order to attack them in. Number one, sleep. And this is bigger than go to bed early. Sleep apnea causes sleep quality to suffer. You can be in bed 9 hours and feel like garbage if your sleep is broken. The biggest underdiagnosed cause of fatigue is sleep apnea. It's not just the big guy who snores. It's wildly underdiagnosed in regular-sized people and in women. The signs: snoring, your partner says you stop breathing at night, you wake up unrefreshed no matter how long you slept, headaches in the morning, drying out your mouth at night. If that's you, ask for a sleep study. A home sleep study is easy and it's a lot cheaper than what it used to be. CPAP treatments have changed lives. I have patients who tell me they don't know what rested meant until they started using a CPAP. Beyond sleep apnea, the basics. Same bedtime, same wake time. Phone out of the bedroom. Dark and cool bedroom. Skip the late night evening alcohol. It ruins your deep sleep. Last caffeine, early afternoon. If your sleep is broken, nothing else gets better. Number two, and this one surprises people, lack of exercise itself is a major reason of fatigue. Most patients assume that if you're tired, exercise will make it worse. But the opposite is true. When you don't move, your heart gets less efficient. Your muscles get weaker. Climbing stairs becomes harder. This makes you avoid stairs, which makes you weaker. It's a downward loop and it ends with people feeling exhausted just from walking across the parking lot. The fix is annoying, but it's real. Start moving. Not a gym membership, not a 5K, just walking 10 minutes after each meal. A short loop around the block on a Saturday morning. Strength work twice a week with whatever you have at home. Bands, dumbbells, your own body weight. Within 2 weeks of moving regularly, most people feel a real shift in their daily energy. Within a month, it can be transformational. This is medicine and it's free. Number three, chronic stress and anxiety. These are real causes of physical fatigue. They are not in your head. When you are chronically stressed, your cortisol stays elevated. Your sleep gets a little shallower. Your blood sugars get shakier. Your inflammation goes up. You feel exhausted, but you just can't sleep. What I hear is called wired and tired. That's anxiety presenting as fatigue. Depression presents the same way for a lot of people, especially men. Men are more often describe it as exhausted, irritability, anger, and not just caring about anything anymore, not just sadness. If chronic stress or anxiety is in the picture, the labs are going to come back, quote, normal, and the patient is going to be told that they're fine, but they're not. What helps? Therapy. Honest conversation with what's weighing you down. Movement, time outdoors, sleep, and in some cases, medications for the anxiety or depression. There's no real shame in that, and it can be a game changer. This bucket gets ignored more than others, so don't ignore it. Now, the 5 labs your doctor probably may not be running. And here's what I want you to ask for by name. Number 1, fasting insulin. Goes with your fasting glucose. catches insulin resistance years before glucose moves. This is one of the most undervalued labs in primary care. 2, a full thyroid panel. Most providers run a TSH, and that's not enough. Ask for a free T4, free T3, thyroid antibodies. A normal TSH with positive antibodies tells a real story. 3, ferritin, your actual iron stores. A normal hemoglobin can sit on top of a ferritin of 12, and you're going to feel terrible. We want ferritin to be generally above 50 in most symptomatic patients. Number 4, vitamin D, the 25-OH version. Most of us in Eastern Kentucky are deficient. It's a cheap test and it's cheap to fix. 5, B12 and folate, especially if you're over 50, vegetarian, or on metformin, or on a stomach acid blocker. For men, add total and free testosterone, drawn in the morning with a sex hormone binding globulin. This list is what separates real fatigue workup from a 5-minute brush off. 3 things to know if you're a woman. Iron loss is real. Menstruating women lose iron every month. If your periods are heavy or even just regular for years, your ferritin can drop without anyone noticing. Standard hemoglobin will look okay until you are frankly anemic. Ask for the ferritin by name. Thyroid disease is more common. Autoimmune thyroid disease hits women 5 to 10 times the rate of men. And if you have a family history, ask for a full panel including antibodies. Perimenopause is sneaky, and it can start in your late 30s. It can last a decade. And fatigue is one of the top complaints I hear from women in their 40s. I've got a whole video on menopause specifically. You can watch it after this one if this is you. What's different about fatigue in men? 3 things to know if you're a man. Sleep apnea is widely underdiagnosed. Extra weight, especially around the neck, is a big risk factor. If you snore or your partner says you stop breathing, get evaluated. Another one is low testosterone. Testosterone declines with age, weight gain, and poor sleep. Symptoms include fatigue, low libido, decreased motivation, belly weight, and mood changes. Not in the standard panels. Ask for it. Depression presents differently. Men are more often likely to experience it as fatigue, irritability, anger, apathy, but not sadness. If life has stopped being fun, talk to your provider about depression, even if you don't feel sad. So here's what I want you to do this week. Here, run these tests, and the names of these tests that I've already said. Week number 1, start with sleep and movement. Phone out of the bedroom, 10-minute walks after meals. If you snore or wake up exhausted no matter how long you slept, book a sleep study. Week 2, book the lab workup. Bring the list of 5 or 6 labs that we talked about. Ask for them by name. Don't accept your labs look fine on the standard panel as a final answer. Week 3, address stress and anxiety. Therapy, build talk with someone you trust. Time outdoors, less alcohol. If you're a member of a church, talk to your pastor. Week 4, fix breakfast. 30 grams of protein stops the sugar crashes that drag your energy through the floor. Fatigue almost never has one cause. It's usually a stack. You fix the stack 1 layer at a time. Now, when to talk to your provider. Make sure you make an appointment if any of these apply. Fatigue lasting more than 4 weeks despite real sleep. Fatigue with weight loss, fevers, or night sweats. Fatigue with chest pain or shortness of breath. Fatigue with new heavy menstrual bleeding. Fatigue with depression symptoms or thought of harm. Those aren't a wait and see. Those are, let's take care of that this week. This is the version of the fatigue conversation I have with patients in my clinic. You're not lazy, you're not crazy. There's always something findable, usually a stack of lifestyle stuff and 1 or 2 missed labs. If this helps, subscribe. I do this every week. Share it with someone who's been brushed off. Remember, I have a free weekly newsletter. The link is in the description. And if you're over 50, check out my second half Strong Davis. It's for those entering the second half of life, addressing all things faith, family, fitness, and finance. Link is in the description. Book an appointment here at the clinic if you want to have a one-to-one talk. Hi, I'm Kevin Davis, physician assistant. Remember, decline is a decision, and I'll see you next week.